Hare Krishna to all the devotees. A very warm welcome to all the participants who have joined to yet another exciting topic on health, which is live on Hare Krishna YouTube channel. Well, I'm Yogaraj representing Bhaktivedanta Hospital and Research Institute, which is a 300-bedded multi-speciality tertiary care NABH accredited hospital which is located in Mumbai Mira Road. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathic, Ayurvedic, homeopathy, and alternative medical therapies under one roof. We integrate modern medical knowledge with holistic approach to promote overall well-being. Our experts emphasize the importance as a cornerstone of preventive healthcare. This initiative is a part of our flagship program, ISKCON Devotees Healthcare Services, which was launched in Mayapur in the year 2023. Through this service, we have supported the health and well being of over 10,000 devotees globally. Today, we bring you a special live health talk on winter breathing challenges, focusing on seasonal respiratory issues and practical prevention strategies. Let me introduce to our today's guest, Honorable Speaker, Dr. Ajay Godse, consultant, pulmonary and sleep medicine and sleep disorder specialist, gaining 20 plus years of experience and qualifications, including MD, chest medicine, diploma in pediatric sleep medicine, and fellowship in sleep medicine. So let's begin our live talk show. Hello, sir.
Hello.
So the first question is, why do respiratory problems tend to worsen during winter season?
Winter is a special season. I'm basically talking in a context of India per se.
Correct.
Because winter we have a less of a sun,
Mm-hmm.
we tend to remain indoor.
Correct.
And these are two important things. Basically, we find respiratory infection rise in a winter.
Mm-hmm.
If I elaborate, when sun is less, obviously the lower part of the air, which is very near to the earth
Mm-hmm.
or the soil, basically have a lot of viral viruses, bacteria, because sun is basically a good protector
Right.
to keep their population at a bay.
Mm.
But when sunlight is low, the viruses tend to accumulate into air. You have a less of a sunlight, more of a smoke, more of a fog,
Mm-hmm.
and that tend to get you more of a exposure to viruses and bacteria, and you fall ill. You
Okay.
stay indoor, so your activities are less. That further reduces your immune system, so you become an easy prey or catch for
Mm-hmm.
viruses.
Correct. Right. Next is, what are the most common breathing complaints you see in patients during winter?
From September to, if I say about my practice, from September to February or mid February, we see a lot of respiratory cases.
Correct.
And not necessarily they come from a known respiratory patient, they come
Mm-hmm.
from a even common people. So people do develop a lot of running noses, cold, common cold, what we see,
Mm-hmm.
throat infection, throat irritation.
Right.
People who have already established asthma or COPD or chronic lung diseases, they tend to get worse in these particular conditions.
Correct. Right. And which lungs conditions, especially during winter season, are most aggravated,
That's
such
what,
as asthma
yeah,
or
that's what I was trying
COPD?
to tell you. The people who have established lung problems, asthma, COPD, old tuberculosis, the diseases which have some scar tissue in their lung,
Mm-hmm.
they tend to get exacerbated. Other than a normal people who getting a upper respiratory tract infection very frequently.
Got it. Got it. And do the patient experience to have more flare-ups during the winter season,
Yes, that's what I
especially
said.
asthma?
September to February is the worst period for respiratory cases.
Correct. Right. And you spoke about the indoor air quality. So, how does the winter contribute to the breathing problems?
Winter per se doesn't contribute to breathing problem indoor
Mm-hmm.
because you tend to remain indoor because of chilly weather outside.
Correct.
So that's why you get exposed to your indoor pollution. If I put into Indian context, we use a lot of coils, the mosquito coils inside.
Mm-hmm.
We tend to have a lot of dhuas
Mm.
inside. If you
Right.
don't have a cross ventilation in your rooms or in your houses,
Mm-hmm.
you tend to get exposed to this particular thing. We have a seepage or molds on a wall. You tend to get exposed to those particular things for a longer duration in indoor. As I said, your physical activity becomes less, which is a very strong contributor to keep your immune system on a higher side.
Correct.
In a winter, that doesn't happen. So
Mhm.
again, you fall ill to all those infections.
Right, correct. And what do the role of like allergens such as dust, mites, and mold
Again,
they
the
play
same thing.
during the winter?
Sunlight is a phenomenally good protector. So when sunlight is not there,
Right,
all these opportunistic organisms tend to flourish in their population.
right.
Especially if I tell you the guideline, then
Hmm.
they say if you have a ticks and mites in your bedding, then you should be washing your bedding at the 55 degrees centigrade temperature once
Oh,
in a week.
okay.
So that tend to doesn't happen in a winter. So you usually get exposed to these sticks and mud because you spend more time in your bedding, more time inside the room,
Right.
and then you obviously get more exposed to these particular things.
So you mean to say these are the home or the indoor things what we are talking about? But what about the corporate culture? The people who sit in the indoor AC, especially.
If you ask me something about AC, I'm a little protective about that particular thing because ACs usually are, if it are used intelligently. When I say word intelligently, that means if you're cleaning those filters regularly,
Mhm.
if your annual maintenance contracts are in place, then ACs at a times can become a genuinely a better friend for you to take care of the winter infection, because ACs, if I enumerate, filters the bacteria, filters the viruses, filters
Right.
the fungi,
Hmm.
filters the dust,
Hmm.
filters the smoke, filters the pollution. It controls your temperature the way you want it. It controls the humidity the way you want it.
Right.
So it keeps your air quality inside better, provided your temperature you maintain between somewhere to 25 to 27 degrees centigrade, and their filters are well cleaned. Maintenance is well done.
Correct. Right. Next question is, sir, how does winter impact the sleep quality in patients with breathing disorders?
That's a very good question, because when you sleep, you tend to have a lot of secretions accumulated in your throat because of a gravity position. Because winter causes a lot of a sinusitis and rhinitis,
Mhm.
those secretions get trapped into the nasal passages.
Right.
And when you sleep on a bed, on your back for longer duration, 6 hours, 7 hours, 8 hours, they tend to get accumulated into your throat,
Mhm.
and stagnation of secretions at a times get infected. Anything gets
Okay.
stagnated gets infected.
Mhm.
So sleep gets disturbed because of a frequent cough, because of a choke nasal passages, because of a sinusitis, because of a headaches. You obviously sleep gets disturbed and you feel agey, irritated in the morning.
Mhm.
Plus, sleep is another very strong immune system protector.
Right.
So when you tend to get not refreshing sleep,
Mhm.
you obviously fall ill very easily.
Correct. Right. Now, as we spoke about the sleeping quality and sleeping pattern, so winters especially people have to be into the bed for a long time, these sleeping hours. So, does the reduced physical activity in winter affect lungs?
Absolutely. Because when you do physical activity, the mucus clearance through your lower part of the lung till here is better. When you don't move around,
Mm-hmm.
your ciliary action, the specific cells which allows those mucus or cough from lower part of the lung to come to the throat so they can spit it out,
Correct.
that becomes little difficult. So obviously you tend to get a more congestion of a sputum or mucus into your lungs. So
Mm-hmm.
that affects your sleep quality as well as your infection.
Absolutely. So, do we see in the current trends, especially during the winter seasons, is there any increase in sleep apnea symptoms?
Sleep apnea is usually because of a narrowed passages in the upper airways.
Hmm.
So as I was telling you, if your throat is irritable, if your throat is congested, if your sinuses are blocked, your secretions okay, obviously those passages are further reduced in their size.
Mm-hmm.
So your sleep apnea symptoms always increase.
Correct.
Plus, people who are on a treatment of a sleep apnea using a CPAP mask,
Mm-hmm.
it becomes difficult for them to use a CPAP because of nose congested. The CPAP doesn't really work effectively till the time their nose nasal passages are clear. So sleep apnea symptoms also increase, and therapy also becomes difficult till the time you don't handle the upper respiratory tract infections well.
Correct. So, can you just elaborate for a layman person what exactly the sleep apnea is?
Okay. Um, if I put it in a layman's language, sleep apnea is basically collapsing upper airway during sleep, so air doesn't go inside your lung,
Mm-hmm.
and your important organs, brain, eyes, heart, kidneys, pancreas, are deprived of oxygen. So
Correct.
obviously all these organs who require continuous uninterrupted oxygen to function better, obviously they become dysfunctional. So you develop hypertension, you develop diabetes, you have a
Diabetes.
thyroid problems, you tend to increase the weight, especially in central position. And if you already have these diseases, then they tend to get worsen.
Mm-hmm.
Two most important complication of a untreated or unmanaged sleep apnea is you can have a stroke. That's a cardiovascular
Oh,
stroke, you have paralysis, or you can have a sudden cardiac arrest or even death in a bed. So these two are very common but not well addressed issues when you don't manage the sleep apnea.
oh, okay. And the machines which are available in the market, especially for the sleep apnea things. So, are they readily available on Amazon, or we need to consult the pulmonologist first and then we can?
The therapy comes into picture only after the diagnosis. So the first and foremost thing is consultation with sleep medicine physician, formally trained for preferably. Get a sleep study done.
Sleep study.
See what your disease is.
Mm-hmm.
Is it really sleep apnea or some mimic?
Mm-hmm.
Understand the severity of the sleep apnea. Calculate the amount of a pressure and the type of machine you require for to treat your sleep apnea.
Got it.
Because these are not a generic machine, this randomly can be given one to another.
Mm-hmm.
So specific therapy, specific pressure, specific mode, your sleep medicine physician will give it to you. And then machine procurement, obviously it's a better to have a somebody official representative of a company rather than Amazon, because these machines are long term machines for you.
Mm-hmm.
They require certain amount of a maintenance and some warranties.
Right.
So probably off the shelf from Amazon would be little risky unless until there is some trustworthy vendor in the picture within.
Got it. Got it. So, we spoke about the nasal congestion part, sir. So, can nasal congestion and the cold air worsen snoring and sleep-related breathing problems?
Yes, obviously. Snoring is all about disruption of your free flow of air through your nasal passages or
Mm-hmm.
airways, I would say. So any obstruction in your air passage, whether it's at nose, at a throat, it you create that particular sound of obstruction of air called that's a snoring.
Right.
So anything which creates a passage narrow, whether it's a secretion, edema, or swelling, reduces the passage diameter and you tend to snore more.
Okay. Got it. So, the snoring pattern is only seen in the obese people, or
Usually, yes, but then we are Southeast Asian, so there are enough studies which tells us that even if you are not overweight grossly all over the body,
mm-hmm.
but even if you have a little bit of a central obesity, little bit of a tummy up, little bit of a thick neck, a small chin, crowded teeth, then you tend to have a passage behind your tongue is narrow, and then you can develop a sleep apnea. So that's a peculiar for a Southeast Asian people ethnicity, that sleep apnea do happen even in a lean obese people also. They are lean, but they are lean obese.
correct, right? So, who are the most vulnerable groups, if I ask you, to winter-related respiratory issues?
Extremes of age. So people, kids who are less than 8 years of age,
Mm-hmm.
whose immune system is not yet fully developed by nature, and people who are tend to be more than 60, 65 years of age,
Mm-hmm.
who tend to have a lesser immune system, they are worst affected.
Got
But that doesn't mean younger population is not affected if they don't take care of themselves.
it.
So if they don't take care of themselves, they also become a same recipient of the
Same
infection.
pattern. Correct, right. So we are going to continue this health talk. So requesting our participants to please check on the bottom of your screen. We have mentioned 24 by 7 dedicated contact number wherein you can get in touch with us and you can avail your healthcare needs. Also, the information of the contact is mentioned to organize such kind of events for your congregation is displayed on the screen. Um, what are the early warning signs of breathing problems that should not be ignored during winter?
Perfect. That's, I guess, a very nice question, because you want to empower your audience when to seek a medical attention.
Exactly.
So when you start feeling breathless,
Mm-hmm.
which you never do with doing a common activity,
Right.
that's a little last stage. So before that,
Mm-hmm.
so if your cold and cough is more than 5 days,
Mm-hmm.
you took some home remedies, you took a steam inhalation, you took some lozenges, and if you're not better, you're running fever
Right.
now and then,
Mm.
especially with the chills. you have a headache, unexplained, your sleep is disturbed. Probably these are enough signs for now get out of a bed, seek a medical attention, a professional medical attention, because now because usually colds get settled on their own if you have a good immune system in a 3 days.
Mhm.
So if it is going beyond 5 days, I guess it's better to go to the next level and seek a medical attention.
Right, correct. So normally the common problems what even me to is having like when I get up in morning, I have a congestion in my nose. I feel like yes, I would be a futuristic patient for sinusitis and a severe headache, especially during winter seasons. So are these early sign up symptoms for the sinusitis if I speak about?
Congestion of a secretion in a nasal passages in a throat in the morning is very acceptable,
Mm-hmm.
because secretions in a nasal cavity to keep the areas of the nasal cavity lubricant is a
Mm-hmm.
natural process. When you tend to get it accumulated there because it doesn't get a drained off with the natural passages because your sinuses are now full,
Correct.
that's a warning sign. But even here, I would say if you can clear it out in the morning while brushing your teeth or cleansing your face,
Mm-hmm.
and you don't suffer throughout a day, and if the secretions of this particular color of the secretions is white
Mm-hmm.
or colorless, it is still okay.
Right.
If it settles in the next 1 or 2 days, you probably is as good as only climate variation.
Correct.
But if it remains more than 4 days or 5 days, it turns yellow,
Mm-hmm.
it runs with a fever, you have a headache now, then probably the bacterial infection has set in, and then you probably need a medical attention.
Correct. Right. So does it affect to our ears as well?
Yes, because your ear, nose, and throat is basically connected from within.
Mm-hmm.
So whenever there is a secretion, you tend to get a pressure changes between nose and ear, and you have a little earache,
Earache.
something like that.
Correct. Right.
So it these three organs are connected together.
Hmm. So we take the first question from our viewer stating, how does cold air physiologically affect lungs and airways?
Cold air dries up everything. Like you must have noticed, in a cold, your skin also get dried. So even the mucous membranes, the inside lining of your airways, also get dried.
Mm-hmm.
So whenever anything gets dried, it gets irritated. You put a moisture here on your skin, but you don't have a moisture. You cannot apply inside the nasal passage. So nature takes care of it. So nature increases the secretion or lubrication within the passage.
Okay.
But you have to have an increased secretion and increased drainage.
Mm-hmm.
But if your drainage is affected, then increased secretion shall get accumulated and you develop a cold. So
Right.
that's a common explanation of why you develop cold in a winter season.
Got it. Got it. Next question we have. What is the difference between viral and bacterial in nature when we speak about respiratory infections?
Usually, most of the infection in respiratory passage, I'm restricting myself to start with the viruses, because your body doesn't have a antibodies against viruses of most of the time.
Mm-hmm.
Viruses are very limited lifespan organisms. So by the time your body understand that virus and develop an antibody, viruses change, they mutate.
Got it.
So other than one or two exceptions of the vaccines available for few viruses,
Mm-hmm.
most of the viruses don't even have a vaccines in a medical practice.
Mm-hmm.
So viruses tend to get an entry inside your body comparatively very easy.
Mm-hmm.
Body's immune or defense system doesn't really stop them. And the moment virus gets an entry into the immune system or body's pathways, on their back, bacteria ride and come inside. So viruses play a opportunistic or favorable role for bacteria to enter. If your immune system is strong, then most of the infection can be restricted at a virus's level. So they are self-limiting illnesses.
Mm-hmm.
People would suffer from 3 to 7 days. Viruses will have their own life cycle, so they'll die out, and you are cured. If you're taking a symptomatic medication, taking care of your fever, having a little bit of extra fluids, some lozenges, some steam inhalation,
Mm-hmm.
then you should be taken care of.
Mm-hmm.
But if bacteria goes inside, and then you develop a fever, yellow sputum, throat pain, body ache, then probably you require somebody to intervene now.
Got it. What's the difference between a common flu and influenza?
Common flu is something which we don't really specify which virus is. Influenza, we have a 4 viruses strains available, so we can name them, and there's a vaccine available for influenza. which surprisingly very significantly protect the people for 12 months.
Hmm.
So once in a year, we advocate these vaccines to our common respiratory complaining patients.
And how often the flu and pneumonia vaccinations can be taken?
Vaccine for a flu is once in a year because, as I told you, viruses mutate very fast. So one vaccine would be effective for 12 months.
Mm-hmm.
Pneumonia vaccine, till recently, we used to have a pneumonia vaccine once in a 5 years. But a new vaccine, which we expect in India, has come into India. Now, this is a once in a lifetime vaccine
Hmm.
for one particular streptococcus pneumonia, which is once in a lifetime vaccine available. So that's a once in a lifetime vaccine. We advocate to the people who are elderly in a age
Mm-hmm.
and who have a significant comorbid condition, something like diabetes, hypertension, heart diseases. We advocate pneumonia vaccine once in a lifetime.
We take a question from a viewer. When should a person seek medical attention instead of self-medication?
I guess cutoff is fifth day, and signs are fever, headache, yellow cough, either through nose or through the mouth,
Mm-hmm.
and body ache. Probably this is the time you should stop your experiment at home. But before that, I guess most of people, if they are physically active, taking a sunlight exposure, eating well food, taking good sleep, they should get treated on their own.
Right, correct.
But definitely avoid the self medication from a chemist. That's my first urge to Indian patients, because you tend to get a quick remedy from a chemist. Most of these chemists are basically habitual of giving certain drugs. They don't know about the disease process, they don't know about the drugs as a whole.
Hmm.
So it's a little risky to take a medication from them without really doctor's consultation.
Got it. Next question we take. What is the correct time to sleep?
uh, Being a sleep medicine physician, I would advocate we need to be as close to as nature's clock. That's
Hmm.
called circadian rhythm. So our day should start with the sunrise, our day should end with the sunset.
Sunset.
So melatonin is the hormone which gets secreted in our body when sun sets. So approximately 3.5 hours after sunset, it's ideal time for to go to the sleep, and you should be getting up before sunrise, a little bit of early to sunrise. So that in a context of India, I would
Hmm.
say somewhere around 11 to 10:30 to 11, you should be in a bed. By 5:36, you should be up and above.
Correct, right.
That gives you 7.5 hours of a peaceful sleep, and you're more or less aligning with the nature's own cycle of a sleep and wake.
Got it. Now, the current trend, what we see on the social media handles regarding the climatic conditions which are getting worsened in the metropolitan city, when speak about Delhi or Mumbai. So, how do the seasonal pollution levels they worsen the respiratory symptoms, especially to those people, those who go for morning walk?
Hmm. Very important question, because we have two things happening in modern India now. One is a craze of doing some physical activity. Everybody is on some other way physically active or try to become physically active, but everybody is super busy also in their in their day-to-day schedule. So the only time what they take out from their schedule is early morning,
Hmm.
and that's a worst time period in the winter season, because as I was telling in a first question also, when sunlight is not there of adequate quantity to clear the smog, I'm saying the smoke as well as fog,
Fog.
then you tend to get worse by walking in that particular environment.
Mhm.
So benefit of having a good health would be actually jeopardized by the quality of our air. So if you really want to go out in a sun, then probably your walk should be after 8 a.m.
Mhm.
and before 6 p.m. And probably that particular time is good time for a vitamin D absorption also, because
Mhm.
your vitamin D from a sunlight gets absorbed only between 8 a.m. to 4 p.m., not before 8 a.m., not after 6 p.m.
Right, correct.
So probably timing of a physical activity, outdoor physical activity, should be somewhere after 8 in the morning.
Okay, okay. What preventive measures can individuals take to protect their lungs, especially in winter season?
Very nice question, because all else said and done, whatever we do, we still tend to get an infection from others also.
Yes.
So probably surgical mask is the most affordable and effective way. The surgical mask is not something which I'm trying to tell a cloth mask. Cloth masks don't give you protection. Surgical mask is something which doctors and nurses use. I'm not talking about N95 per se. The blue and green color surgical mask, and your nose and face should be totally covered. We have this particular tendency amongst our country that we we get the mask down when we talk, we get the mask down when we cough, when we get the mask down when we sneeze. So there's no protection.
True.
So mask should be always on your nose, tightly closed in a nose shape, and below your chin, completely covered. And then you are protected from environmental toxins. You are protected from others people's cough, sneezes, and even others are protected if you are running any infection in your upper respiratory tract.
Got it.
So mask is the first thing. Drink quite a large amount of fluids, maybe 1.5 to 2 liters, because fluids will keep your mucosal membranes inside always moist. Body doesn't really have to increase the secretions to keep it moist. Physical activity, encourage yourself to do outdoor physical activity. Don't keep yourself indoor for a long time. Somewhere between 8 to 4. Sleep adequately. If you have a resource of having a air conditioner in a bedroom, use them, but temperature should be not less than 25 degrees centigrade, and because then that is a temperature which aligns with your body's core temperature. It should not be cold. Keep your fans as low speed as possible. I want to say something in this particular platform. Your cold is not because of a cold air. Your cold is most of the time because of a blast of the air. So your fan is worse for you than even an AC. So fan on a 5 speed with a outside temperature of 42 degrees centigrade will still give you cold. But even if you are on a Rohtang Pass with a -7 degree temperature with no blast of air, you'll still be better.
Oh.
So it's not a cold air per se, it's a blast of air which your nasal passages cannot really filter it out. That's why everything goes inside unfiltered and you develop infections.
Okay. Got
So
it.
keep a fan as low as possible. Use AC to keep your inside room air quality better.
Got it. We take a question, sir. This is something about not related to this topic. So the question is: no matter how hard I try, my mind always picks up topic to overthink at night,
Mhm.
delaying my bedtime. How to stop it?
Probably very wrong platform to address this question, but I will still try to address this. Okay, so you're basically thinking a lot about day-to-day routine. So you have typically anxious personality. The most effective anti-anxiety tool, I would say, is a physical exercise. When you start involving yourself into strength training exercises, you tend to become little more positive outlook towards your life. So whenever you get yourself fixed into something which you're thinking every now and then, get out of that particular place. Maybe do 6 Surya Namaskars, 6 squats, walk outside the home, go in the
Right.
sunlight, and come back. Obviously, you will be a different person at a mind level that time.
Correct. Right.
Obviously, this is all said and done, very generic answer for this particular platform. If you have this particular problem, in spite of these small little remedies, persist, then you require a psychologist help, a professional help to actually look for the reason why it is happening and probably treat it accordingly.
Right. So normally, any person after even the recommended by the physician or a pulmonologist, some of the medicines or the cough syrup they act as if like they go on and on with the sleep patterns in the night times. So how should a layman person deal with such kind of medications?
You mean to say your cough syrups can increase your sleep time?
Exactly.
Yes. Cough syrups tend to have some sedatives.
So is there any alcohol factor in it?
Every cough syrup has an alcohol base or menthol base. So they are needed for the preparation. So if you believe that particular cough syrup is basically its effect remains more than your sleep, it goes into your daytime, then the timing to take a cough syrup can be changed.
Exactly.
So instead of taking at the bedtime 11 p.m., you should be taking at 7:30 p.m. So by the time by 6:30 you want that effect to wear off, its effect is worn off.
So as such, you said like
Earlier is a
yeah.
better. Keep a dose reduced. Instead of 10 ml, take a 5 ml. So you are protected in that particular. But anyway, I want to say in the same breath that cough syrups don't cure you. Cough syrups only gives you soothing sensation for some time. So if it's an infection, if it's a congestion, if it's an asthma exacerbation, if it's a COPD exacerbation, if there's a disease, then cough syrup is not a remedy. Cough syrup could be some type of a support system. The core treatment requires to be initiated and completed with the doctor's advice.
Correct, right. Normally, we tend to see some advertisements on the televisions or on the social media handles. Nasal spray. Do they really take care of our nasal congestion?
There are two types of nasal spray. One is a normal saline nasal sprays, which basically reduces the swelling of the nasal passages. They do work, and they are safe also. In fact, they are safe to that level that I remember my kid, first one day born, first day when his nasal passage is congested, gynecologist or pediatrician actually subjected those 2 drops of a sterile nasal spray in their nostrils. So they are safe to that level that even a one first day born baby can also handle it. They are sterile saline.
Hmm.
That's the one thing. The second type of a nasal sprays are a medicinal nasal sprays, which we and ENT people advocate for people who have a allergic rhinitis or allergic sinusitis. What they do is they have a anti-inflammatory agents.
Mhm.
So what it happens is your nasal passages are congested, swollen, and secretion. All this together is called inflammation, not infection.
Got it.
So this anti-inflammatory nasal spray reverses that particular pathology, reduces the congestion, reduces the swelling, reduces the secretion, and opens the nasal passage.
Mhm.
But they generally needs to be taken for 7 days to 14 days in a row. Don't expect its result in a 1 or 2 days.
Mhm.
So those sprays are basically helpful, whether it's a saline spray, sterile saline spray. Don't put salt water from your home inside your nose. That's
Mhm.
not something which is a safe. So sterile saline sprays are good. Some medicinal sprays which are anti-inflammatory are good. I would want to mention one more spray here on this particular platform. There's one particular brand, I won't name it,
Mhm.
which is very common in the Indian television or in the social media.
Hmm.
People tend to use that particular nasal spray every now and then when they have a nasal congestion.
Right.
It does open your nasal passages for first 3 days. If you keep using it after 3 days, it rebounds its action, and because this nasal spray is there, you get a congestion back.
Okay.
So avoid these nasal sprays. So anything which is not prescribed by ENT doctor or a chest physician for your allergies, just avoid that,
Mhm.
because probably getting you hooked up to their nasal spray product is something which could be a marketing ploy rather than anything else.
True. Absolutely. Jago grahak jago. Next question we take from our viewer: are steam inhalation and humidifiers beneficial during winter season?
Steam inhalation is yes, because steam moisten the passages, it loosens out the mucus, so it helps you to clear out your nasal passages and oral secretions.
Mhm.
But don't depend on that as a ultimate remedy. In one first 1 or 2 days, if it doesn't help you, then seek a help, a medicinal help.
Got it. So again, requesting our participants and our viewers to check on the bottom of your screen. We have mentioned 24 by 7 dedicated contact number wherein you can reach out to us for any healthcare needs. Also, the contact information in form of a template. What are the services that we offer under our flagship program, that is ISKCON Devotees Healthcare Services? You can see our offerings that has 24 by 7 helpline number, special health talk sessions and webinar sessions. The contact number has been displayed. And for other services, to chat us online, ask Bhakti. So do visit our official website, that is www.bhaktivedantahospital.com. The contact number is also mentioned. You can get in touch with us on WhatsApp. So next question is, what common myths during winter breathing problems would you like to clarify?
Myths. Hmm, I can't recollect anything, but probably by eating certain foods, you can develop a cold. By drinking a milk, you develop a cough. Something like that, not precisely for a winter, but that's what is very prevalent in our community.
Mm-hmm.
I'm basically not a authority person to talk about food and its effect on our body, or rather that the the constitution of our body. But usually, if you get that, let's come to this particular winter part. Suppose you drink a milk in your summer season, and if you don't develop anything,
Mm-hmm.
but if you drink the same milk in a winter, you develop a cough. Then I probably won't blame a milk. I'll probably blame the winter, because that particular parameter still remains same everywhere.
True.
So if you have a banana or something like a cold food, which is generally called as a cold food, or curd,
Mm-hmm.
in your summer, somewhere with your lunch, 12:30, if it doesn't affect you, but if it affects you when you have a dinner, 7:30, 8 o'clock,
Mm-hmm.
then probably you should not blame the food. You probably need to blame the environment, or the winter, or the air quality that particular time.
Right.
You can think of any myth for a
No,
winter?
I particularly don't
I
think of.
I genuinely, I see a lot of patients 30, 40, but I really don't understand which myth is clearly for a winter. Probably stay indoor is another advice probably people give to the people. Yes, it is true. Stay indoor till the time sunlight comes.
Hmm.
So even I would advocate it. Go outside only after when your sunlight is bright and good sunlight.
Mm-hmm.
So earlier part of the day when dawn is not yet happened, the smog and smoke is very much there. Don't go out when there's a traffic more, because we know in urban India there's a lot of smoke, environmental pollution,
Hmm.
engine smoke. So I guess I would definitely avoid. There's a construction. There's a continuous construction going on in all the
True.
metros of a country. The whole
Absolutely.
India is in a rebuilding state.
Mm-hmm.
So avoid that particular thing. So I would advocate to remain indoor, especially when there is no sunlight and when there's a air quality outside because of any reason which is not good.
Right. One myth I would recollect
Hmm.
during my childhood times, I'd been hearing through my parents as well, कि lot of heat is there inside the body,
Okay.
which actually aggravates the kind of cold. So let the cold come out of the body. So this is a kind of a myth, basically.
Okay. So
I.
increased secretion through your nasal passages is what we so called.
Hmm.
So increased secretion through your nasal passage is basically reaction to your body to the dryness of the nasal passages. So okay, let's understand this probably. If I keep my mouth a little bit of a open, then my saliva start getting increased to
Hmm.
keep that particular dryness elevated.
True.
Exactly same thing happens in nasal passages. The dry cold air, and I'm using the word dry cold air, dries up the nasal passages to facilitate that particular passage's lubrication. Body increase the lubrication fluid. If it gets increased adequately, then you are just lubricated moisture.
Mm-hmm.
But if it increases more, or it doesn't get drained because of a closed sinuses, then you develop a cold. So I really don't know where the heat from a body comes from. I'm probably ignorant about it.
Um, we'll take a next question, sir. I think from the same viewer we are getting one question. I go out for run in morning and feel fresh,
Mm.
but I can also feel the pollution I inhale. Is there anything we can do to prevent the pollution from causing damage?
I already give answer to it.
Yes.
Run outside only when the sun is bright. And please don't make a mistake of wearing a mask and run. That's what I wanted to give in this particular person's question.
Hmm.
Because when you put a mask on your nose and mouth, you tend to filter air very significantly, and the increased demand of your body to have a more oxygen, more air, doesn't get satisfied when your mask is on. So you'll unnecessarily feel breathless when your mask is on. So don't run with your mask on, run without mask on. If you cannot run without mask, then just have a brisk walking. That probably will give you the same health benefits.
True, absolutely. Next question we take. Does sleeping during the day give the same impact as sleeping at night, or does it affect the health?
I probably would repeat my question answer again. Your sleep and wake cycle should be as closely aligned with the nature as possible.
Mm-hmm.
So when you sleep in a daytime, it doesn't really give you that particular type of regeneration or relax or refresh sleep. Yes, a 20 minutes to 30 minutes of a power nap, or what Indian culture usually advocate as siesta after food, is something which will give you immense benefit to increase your concentration and everything. But if the moment it increases beyond 20 minutes to 30 minutes, it becomes a sleep, and that will make you difficult to fall asleep in a night. And you tend to sleep in the morning and you tend to not sleep in the night, which will definitely affect your body at every small cellular level.
Mm-hmm.
So you metabolically you would be affected, you will be affected at the immune level, you will be developing more infections, your cognitive, the thinking ability would change, your concentration would change. So night sleep is far more beneficial than daytime sleep, to make it concise answer.
Mm-hmm. Right. We were talking about the snoring pattern. So I'm sure like you might be getting the patients coming with the complaint of the nasal bone. It has been thickening of it. So during night time, especially when we sleep, so there is a pattern of snoring. So does people fall into that category because of that nasal bone thickness?
So you mean to say if there's a something called a nasal bone alignment problem.
Yes.
So there's something called deviated nasal septum,
Mm-hmm.
DNS. Yes, it does affect your airflow. So you tend to have a little bit of snoring because of that. But one more thing I want to tell you here, when you have a deviation of a nasal septum from midline to some, suppose on a right side, you will have a lesser passage on the right side. But on the same time, you have a wider passage on the left side also.
Mm-hmm.
So, and your nose is bifurcated into two sections only for a 2 inches. Beyond that, it's only one passage.
Mm-hmm.
So, subjectively, definitely you'll have a little bit of a problem, but air delivery inside the lung would not be affected that much.
Okay.
Yes, on a smaller side of the passage, your sinusitis would be more because secretions won't get enough space to drain it out.
Mm-hmm.
So obviously, you will be having a more respiratory, upper respiratory nasal infections more when you have a deviation of septum on one particular size.
Right.
Snoring also gets affected, but snoring probably won't get affected because of deviated nasal septum per se. It would be get affected more of a retained secretion there per se.
So does the inflammation of bone it is from the childhood or from the birth itself,
Yes,
or it
it's a
gets
basically
developed?
normal variety. Your nose passage, the central bone of the which separates two nostrils, gets separated a little bit here and there. But if I tell you something, if you get our all people, everybody's CTPNS done, everybody would be having a little bit of a deviated septum, because
True.
God has not sat with the vernier calipers and microscope to keep your symmetry into the place.
True.
But if it affects you with a recurrent nasal infection, you should not be ignoring it. That's for sure.
Got it. Got it. Uh, we are having a next question. Is asthma and COPD hereditary?
COPD is not hereditary. It is something which person acquires over a period of years together by
Mm-hmm.
staying in a smoking environment, polluted environment. When you tend to have a BD or cigarette smoker, you work on a biomass fuel. People who tend to have it in a village, so you develop COPD over a period of 2 or 3 decades of exposure of smoke. It is not hereditary. Asthma, I would not use the word hereditary, but I would definitely say it runs into the family.
Mm-hmm.
So if I have asthma, there are high chances that my kid would have asthma. So asthma runs into family, but that doesn't mean every member of family would have it. So asthma does have a family connection, but COPD is definitely not a hereditary or familial connection.
So if anyone has in the family history of asthma, what are the precautions need to be taken by a person?
Okay, the first and foremost insight I want to give it to them is, when you have a history of asthma in your family, whether your siblings or whether your parents or your grandparents, body blood relations basically,
Right.
then every recurrent cold and every recurrent cough which happens in an early childhood,
Hmm.
when you are a kid, you should not be ignoring it as a common cold. That's the first thing I want to tell you, because that's a time your organs get developed, they get mature. So every little cold and cough, every time your body is trying to fight with something which is not it's supposed to fight.
Hmm.
So suppose my body is trying to fight on one front to take care of the nasal or respiratory symptom, and the whole energy is diverted towards the fighting. It gives a lesser energy for a development of a muscle, bone, and organs.
Got it.
So you always see people who tend to fall ill very frequent in a childhood. They tend to develop bodily and cognitively little weak.
Weak.
So don't ignore those recurrent colds and cough in a childhood.
Mm-hmm.
Seek a professional advice. If it is happening more than 3 times or 4 times in a year, I'm giving you a number, then probably pediatrician and pediatric pulmonologist would be a better people to handle these particular things.
Got it.
Earlier start of a treatment is always going to save them complications of these particular diseases in a later part of the life.
Got it. Got it. We take the other question. What do we do to deal high pressure through CPAP or sleep apnea?
Oh, we are talking about respiratory infection in winter season. Okay. You said, how do you manage high pressures because of CPAP?
Yes.
CPAP. Okay. Now, when you say high pressure, it is subjective word. So high pressure is for you, for that particular person.
Hmm.
Now, to tackle this particular problem, we need to calculate the appropriate pressure for that particular person.
Mm-hmm.
The process is called titration.
Okay.
So in a Bhaktivedanta hospital, we do titration method where the person who is a diagnosed case of obstructive sleep apnea,
Mm-hmm.
the amount of pressure he requires, the mode he requires, and the type of mask he requires, we actually systematically calculate and give it for them. So it's a more of a personalized precision therapy rather than one size fits all for everybody.
Okay.
Now I understand that being a practitioner for sleep medicine since last 11, 12 years,
Mm-hmm.
since the time I came back from US after doing my fellowship in sleep medicine, this facility of titration is not available in most of the part of our country.
Okay.
So what happens is, like this particular respondent who has asked question, he must have been given auto CPAP um, of a very large range of pressure, something like a 4 to 20, and that he must be finding it's a difficult to sleep with that particular pressure.
Mm-hmm.
So the remedy is basically look out for a person who has a titration facility, especially manual titration facility, and get your pressure requirement for yourself calculated, and then use a mask. It would be peaceful and comfortable for you.
Got it. I think sir has responded. Report says 55%. I need it.
No, I didn't get this. 55% needed what? Pressure always comes into centimeter of water.
Mm-hmm.
So 55%, I really don't know what he's trying to mention.
Okay. Sir, I would rather suggest like you can get in touch with us with the contact number what is
Yes,
mentioned,
that's a better.
and you can consult Dr. Ajay Godse sir
That's a better
online.
approach. Yeah, true.
Next question we have, sir. Do chronic lung patients often need medication adjustments in winter?
Yes, very important question. People who are very much control on asthma and COPD medication in a summer and summer precisely, they do require some type of a medicine adjustment in the rainy season as well as in the winter. Climatic fluctuations do change their response of a medication to the disease.
Mhm.
So yes, we generally advocate few visits. We basically tailor few visits of our patients in a certain way that we get them pre climatic change visits. So something like for a car, you have a pre-monsoon checkup. We always get a pre-monsoon checkup, pre-winter checkup. So we
Hmm.
schedule 3 monthly visits so
Hmm.
that they get themselves equipped to handle that particular 3 or 4 months without any disturbance. Yes, the question answer is yes.
Mm-hmm.
Climatic changes do require adjustment of the dosages.
Right, right, true. How do diet, hydration, and immunity influence lung health in winter?
Completely. In fact, lung health is all about diet, sleep, physical activity, and vaccination. So if you're vaccinated for your two vaccines, influenza and pneumonia, you're more or less protected
Mm-hmm.
for a commonest infection available. If you keep your diet well balanced, especially a little bit of a more protein, somewhere close to 20% of your total diet, I would advocate don't go beyond 20% of your diet come from the protein. It should be 20%. More protein is also not good for your body, and less protein is obviously not good for your body. So a little bit of a protein rich diet, little bit of a sunlight and physical activity will give you vitamin D, which is a phenomenally good immune protector.
Mm-hmm.
What we are discussing about is sleep, I said. peaceful,
Diet,
refreshing.
hydration, and immunity
Hydration, yes.
balance.
Drink water as much as can, because winter doesn't make you thirsty. So you
True.
tend to drink less water. Summer makes you thirsty.
Mm-hmm.
So winter naturally doesn't make you thirsty. And if I was advocating the person like me or person who works in a corporate say, environment, they have ACs on.
True.
Again, ACs on doesn't make you thirsty.
Mm.
So you tend to drink genuinely very less water. So maybe have a water alarm somewhere in your bed, on your mobile, on your smartwatches. Drink water as much as you can at a regular interval. Keep yourself hydrated. That helps your body to tackle the dryness of your mucosa well. It doesn't really have to increase the secretion on their own because your water intake is less.
True.
So yes, all these factors genuinely affect your lung health all throughout the year.
Right, correct. Sir, as time is tickling, we'll take only last two questions.
Wow, nice.
Um, are there simple breathing exercises you recommend during this winter months?
Yes, breathing exercises basically are disciplined breathing techniques.
Hmm.
I don't want to use any particular adjective for that, but whenever you take a deep breathing in a disciplined manner, you allow your lung to expand to its capacity. You hold a breath for a few seconds. If you are normal people, I would not advocate to hold a breath to people who are breathless. That's the first thing I want to clear in this particular
Hmm.
session. Pranayama is not for people who have unhealthy lungs. Pranayama is only for people who are for healthy lungs.
Got it.
So, but breathing, simple breathing exercises, taking a deep breath, hold it for a little longer, maybe 2 or 3 seconds, and then exhale it slowly,
Mm-hmm.
helps your body to get maximum capacity of oxygen,
Oxygen.
allowing it to get transfused into your blood effectively and empty out your lung when you do a slow exhalation.
Mm-hmm.
So you're using your respiratory system to its optimum level when you do breathing exercises.
Hmm.
Again, breathing exercise at a stationary position is better than running with a mask. So that is not a breathing exercise, that's exertion.
Yeah.
Okay.
Is DNS related with sleep apnea? Do you recommend surgery?
If DNS is significant, then it does require surgery, but DNS surgery doesn't cure the sleep apnea.
Hmm. True.
So if DNS surgery is to be done, it should be done for a merit of a DNS, not for a sleep apnea. That's what I want to clarify.
Mm-hmm. Got it. Last question, sir, for this evening. What key message would you like the listeners to remember for protecting breathing and sleep health in winter?
So this is summary of my whole
Yes.
talk. Okay, so basically stay indoor if the environment is not good for your lung. So especially go outdoor only when there's a bright sunlight.
Mm-hmm.
Come indoor again after 6 p.m. when the sunlight is not there. Avoid smoky, polluted areas. If you have to go out,
Hmm.
use a surgical mask. Keep physically active yourself. Have good protein diet. Have well hydrated. Sleep well, refreshing sleep. So these are basically 4 points which will make you protected at an
Hmm.
immune level to fight whichever infections comes by. Because respiratory infection is something which you cannot really avoid because you have to breathe.
Actually,
And when you
true.
breathe, viruses get a gates open to come inside.
Hmm.
So what happens next is how well your immune system wise to hold them there rather than going to get penetrated into deeper sections of your lung.
Got
So surgical mask is the only way you can possibly avoid bacteria to come in. Viruses can still go through the surgical masks.
it. Absolutely. So, thank you so much, viewers, and all the participants who were there with us from the start of the session. And thank you, Dr. Ajay Godse, sir, to remove your valuable time and to share us the insights on the winter breathing challenges, especially the respiratory issues, what we spoke about. We will connect with you, viewers, again with the another insightful health topic with some another consultant. Until then, take care of your health, take care of your family, and mask up during this winter seasons. Take care. Hare Krishna.
Hare Krishna. It's my pleasure. Hare Krishna.